is to warm up their feeds. Okay, next. The next two things you have is PKU. Now, I do want you to remember we already did sickle cell and thalassemia in hematology, so you're okay with that. PKU is huge. You need to know that one if you know nothing else. So let's make sure we know that this baby cannot have any protein. Basically, they're a strict vegan without the beans and the peas. Strict vegan with no nuts, beans, or peas. If it has a face or a mommy, they cannot eat it because it's a protein, so no meat. They have a face or a mommy, right? Whatever the food is, if it ever had a face or it had a mommy, they can't eat it. Now, breastfeeding is actually fine. There are special pre-digested formulas that this baby needs. Alimentum is one of the more popular ones. Maybe you guys have seen it. These are very expensive, so this patient needs a referral to WIC. What does WIC say? Women, infants, and children. So don't forget that. Women's, infant, and children is a federal program to help parents out. Make sure your patient knows that this is not related to poverty, it's related to the need of the child, and it's for working parents. Hell, the poorest people are the working poor. Okay, you can't afford this shit, she's ridiculous. Now, the first test that we do is done in the newborn nursery, and go over to the right-hand side. It says it already there. All I want you to do where it says babies are tested, I want you to write on top of it, metabolic screening panel in newborn nursery. Metabolic screening panel in newborn nursery. Highlight where it says a minimum of 24 hours after beginning milk. So this is protein ingestion, a minimum of 24 hours. In other words, you can't do the test on NPO babies. They have to eat because we have to check the protein. Retest in 7 to 10 days to catch what? False negatives. Okay, you better know that. To catch the false negatives. Okay, the next page. Cystic fibrosis. Oh, you know what? Do one more thing for me on the PKU kid. Put autism common. This baby often has autism. Over there by behavioral problems, if you want to write it there, it's fine. And then under mental retardation on the same side, put failure to thrive. Where it talks about cereals, fruits, and veggies in moderation, put no Jell-O, no chewable vitamins, and no gluten. So no Jell-O, no chewable vitamins, and no gluten. Okay. Fibrosis is in there somewhere. Okay. Oh, yes, this is good. Okay, so this whole page, put at the top, know this well. Know this well. Now remember PKU and this patient, both of them, autosomal recessive. Write those fancy words. Here we go. What does autosomal recessive mean? Both parents must have the trait. Autosomal recessive. Both parents must have the trait. Seen more in Caucasian, but I know quite a few African American kids. They had their first stem cell transplant last year and cured it. Ordinarily, there's no cure. When you look at this baby, there are 3 body systems affected. On the left-hand side, if you look at the list of crazy, that's respiratory. Does everybody see that? You got chest physiotherapy, aerosol bronchodilators, mucolytics, respiratory issues. So you don't mess with the respiratory system right there. Go down a little bit more. You see it says pancreatic enzymes. So the pancreas or digestive system is affected, but pancreas is the big one. Over on the right-hand side, you want to remember, let's see, does it say it? No, I don't see it. Do I see it? No, I don't see it. So add it, and if you see it, let me know. You need to know the sweat glands are affected. The sweat test is how we diagnose this kid. We do a sweat test. It was on Nurse Jackie. Had the kid on there, they were making him hot and sweaty. Diagnosis is done with the sweat test. Now, if you go and stay on the left-hand side, you see the meds. I want you to highlight chest physiotherapy. Because of the pancreas, I want you to monitor the blood glucose because they're going to be a diabetic. It says aerobic exercise underneath that, put swimming, or next to it, put swimming. This water-soluble form of vitamins, A, D, E, K, remember those are fat-soluble vitamins, but the child cannot digest fat, so we give them in a water-soluble form. But A, D, E, K, highlight it and make sure you know typically this is a fat-soluble vitamin because the pancreas digests fat and the pancreas is diseased with this child. We cannot digest fat, so we have to give them in a water-soluble kind of format. Remember, it says on that same slide, pancreatic enzymes. Here's the most important thing about that. You got to take it with every single meal. Take it with every single meal. Never crush it, chew it, or put it in milk. Pancreatic enzymes. Never crush, chew, or put it in milk. If you go over to the right-hand side, you'll see everything that this poor kid is going to suffer with. When they have this bad cough, I want you to remember they're going to lose a lot of weight. Coughing takes a lot of calories. It burns a lot of calories. Does that make sense? So they're going to lose weight. They're not going to keep their weight on them. It's a sticky, dry cough. It's very chronic. It's recurrent upper respiratory infection. So what do they need every year? Flu shot and pneumonia every 5 years. This patient's life expectancy when I graduated out of nursing school was 19 years old. It is now 35. So the life expectancy is 35. They will die from a respiratory complication. They're going to have clubbing and a barrel chest. Add that. Clubbing and a barrel chest. Next to abdominal distension, write this big fancy $4 word. Oh, it's down there already, yay. Go down a little bit where it says fatty, stinky stools and highlight steatorrhea. But that's why their belly is distended, because they're bloating. So they have bloating, abdominal distension, flatulence, steatorrhea, all of that's there, except for the bloating. The growth retardation that you see, put failure to thrive. This patient is infertile. Infertile. Highlight down at the bottom on the right-hand side where it says meconium ileus in the newborn. It means failure to pass meconium. failure to pass meconium. You can tell this is a big one. Last thing you write is delayed puberty. Delayed puberty. Okay, now sickle cell we already did in hematology. So if you remember, we did that already. Where did I put that? The next page is what? Oh, that's cool. That's another one where everything you need is actually on the page, but I'm going to give you a little bit of extra love here. Remember to write this, trisomy 21. They have 3 chromosomes on the 21st chromosome. 3 on the 21st chromosome. Remember how you learn chromosomes come in pairs? They got 3 on the 21st chromosome. Trisomy 3, trisomy 21. That's the other name. The street name used to be, and yes, you need to know it, mongoloid. The street name used to be mongoloid. Street name used to be mongoloid. If you saw the movie Precious, that's what you saw. They called it a mongoloid in the movie. Now, the patient of this, the parent of this baby, the mother, during her pregnancy, she would have had a low alpha fetoprotein, low AFP, right? She would have had a low AFP. Now, look at the paper itself, and let's fly through this paper. The sparse hair is always straight. It's at the top, we're going in order. Sparse hair is always straight. No matter black child, white child, doesn't matter, it's always straight. You see the eyes. Then I want you to squeeze between eyes and mouth. Hit cardiac and GI birth defects common. Cardiac and GI birth defects are common. Under mouth, you see it says protruding tongue, highlighted. And remind yourself, aspiration risk, do not delegate to UAP. Don't delegate feeds to UAP. Under hypotonic muscles, put breech during pregnancy. This baby was breech. At the top right-hand side, small head, flat face, nose, all that's there for you. Ears. Then you see something called broad, short neck. I need you to put this. Thick nuchal fold. What does nuchal mean? Neck. Thick nuchal fold on translucency ultrasound. Genitalia, I need you to highlight cryptorchidism. What does that mean? Undescended testicles, failure of the balls to fall. Yep, failure of the balls to fall, undescended testicle. On the feet themselves, write club feet. This patient has club feet. They may need braces, casts. I wrote it right on the feet. Club feet. Okay, club on one foot, feet on the other. What's going on with the hand?
Short.
Well, no.
They don't have
Simian crease. Highlight it. So look what I did. And I need you to do the same because most of you don't know what it is. I put one up on the board a long time ago. It's still there. Simian crease. Draw a straight line right across the palm. Look at your own hand. You don't have one. However, having one does not mean you have Downs, because I've had 3 students in 20 years with the simian crease. The two that had it were twins, and they look like they have Downs. And their mother was told they look like they have Downs, but they don't. They were twin girls in my class. Okay, babies, that's that. Now, wait, on the same page, write these two. Do me a favor, write it at the bottom. Put neural tube defects at the very bottom, underneath everything. Neural tube defects, and write the two examples I gave you, spina bifida and anencephaly, and put high AFP, right? Because if you have a neural tube defects, isn't your alpha fetoprotein high? High AFP. The AFP is high because it leaked out of the hole you have in your body. The AFP is high because it leaked out of the hole you have in your body. Okay, we're moving on here. All right, next, we did G6PD and hemophilia and hematology. You have 2 on this side to do. Find your cleft lip and palate. Oh, you know what? The next one is Duchennes, because we did hemophilia in hematology. So find your Duchennes. This is a real quick one. Highlight onset, 3 to 5 years old. Highlight genetic, and put X linked. What does that mean? Mom is a carrier. Males are affected. X linked. Know that language. X linked. Mom is a carrier. Men are affected. Now, one of the developmental milestones for a 3-year-old is that they should be able to ride a tricycle. Highlight here how it says they can't. So go down the list and highlight difficulty climbing stairs, running, and riding a tricycle. Because that's a developmental milestone. They fall frequently. Then I want you to see in the middle of the page with the little line of children child getting up off the floor, positive Gower's sign. Put a positive right before it. That's called a positive Gower sign. He's on the floor, and the only way he can get up is if he pushes up with his hands and then walks his body with his hands to stand up. Look at his hands. He's pushing off the floor. He's pushing off his feet with his hands. Okay? His legs have atrophy. Very often they have atrophy, which means the muscles are going to waste. At the bottom, the key is ambulation frequently impossible by age 12. This child will die between 15 and 18 years old, probably from a respiratory infection. So frequent infections, turn the page. Cleft lip and palate. One of the most important ones in the whole packet. Now, this is a genetic defect they're born with. So if you see cleft lip and palate, it's a genetic defect that the patient is born with. It is not autosomal recessive or X-linked. It's called multifactorial. This baby preoperatively will need a Breck feeder, B-R-E-C-K, Breck feeder. That's usually feeding through a catheter because they cannot use nipples at all. We would prefer mom to breastfeed. Sometimes they don't, but we beg them. So we prefer them to breastfeed preoperatively. This baby will not have surgery right away. So this baby will have this facial deformity, and people will be cruel and say mean things to this mother. I delivered a baby like this. She was 19. The best thing you can do for this family is show before and after pictures. So we have someone in our class with this, you wouldn't even know it. The palate, if it has a cleft or hole in it, you may not know it if the mouth does it. So the cleft, lip, and palate is easy, but the lip may be perfectly fine, and nurses check for a cleft palate by putting their finger in the baby's mouth and checking the strength of the suction. So we all do it. We put the glove on our hand, we put the finger in the mouth, see if they can suck it, then they don't have a hole in the roof of their mouth. And we rub our fingers across the top to pray that we don't find a hole. Sometimes the holes are very tiny, but typically it's jagged edge crazy, okay? It looks awful, but they do not get operated on right away. It takes a long time for them to get operated on. So mom is gonna have to know how to manage this baby at home, and that is the hardest thing. On your exam, remember that this is multidisciplinary approach. Multidisciplinary. So what do you have? Pediatrician, speech therapy, neurologist, EENT, plastic surgery, nutritionist, multidisciplinary. Post-op, this baby needs restraints. What kind will you use? Elbow restraints. You'll automatically have an order for it. Elbow restraints. This baby is not allowed to cry. They're not allowed to suck. No crying, no sucking, no pacifier. They will come out with something called a Logan bow. A Logan bow apparatus in their mouth. A Logan bow. Keep it in place at all times to protect the suture line. Keep it in place at all times to protect the suture line. Every single feeding, you have to rinse their mouth out by letting them drink water. Now, we don't usually give babies water, and we're not giving them a lot right now. They just rinse their mouth out right after eating. So they're going to rinse their mouth out, so you have to chase every feeding with water. And the nurse has to make sure she keeps the area so clean that no crust will build up on the suture line. Because if it does, we're going to have massive scars. So clean so well, you clean any crust off the suture line to prevent scarring. Chase every feed with water. Burp this child frequently. Okay? And we're trying our best to prevent aspiration. Do not do too much suctioning. Avoid suctioning. No straws. No bottles. Side lying position after eating.